Gauteng province, which surrounds Johannesburg, is South Africa's most populous district. And it's what's happening here that's triggered alarm in South Africa and now around the world. We've been following Gauteng for over a year, a district of poor townships. Only 24% of South Africa's population is fully vaccinated. Gauteng has been hit by wave after wave of COVID. Cases had dropped off recently because people had already been infected or been vaccinated. Then along came Omicron. Dr. Richard Lessells is one of the first scientists to study the new variant's genetics.
This is all happening very recently. 3 weeks ago in Gauteng province, the case numbers were around 100. Now they're kind of 2,000, 3,000. We've seen this very rapid rise.
What is it about this variant that worries you?
What we've seen is this kind of very rapid rise in infections. And we've seen that in a part of the country, in a population where we thought that people had a lot of immunity. And the fact that this virus is now spreading so rapidly and so easily, it seems, it's a highly transmissible variant, but also that it may well be able to better get around some of the levels of our immune protection.
Cases across South Africa are up 63% since the start of November. Omicron, it seems, is a bee that can sting twice. We still don't know how badly. Anecdotally, doctors and nurses describe symptoms as flu-like. But many of the cases detected so far here are in young people, expected to be mild anyway. And they've been found early. And there's always a lag for symptoms to begin. That lag could mean as quickly as this variant was spotted, it could already be everywhere.
I expect over the course of this week, we're just going to see the number of countries reporting cases rising.
How likely would you say it is that there are already cases in the United States?
Very likely.
Richard, I'm curious what the experience there has been with PCR testing. Are they detecting the Omicron variant?
Yes, they are positive. So it is not invisible, but with the PCR, which is the more elaborate test, it can take up to 24 hours to get a result. Those work. They're now checking to see how effective the rapid antigen tests are, the ones you can get in your pharmacy that give you results in just a few minutes. They're still checking on those.
Oh. Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.